Good afternoon. On behalf of Pelham Medical Center and Spartanburg Healthcare System, I welcome everyone and thank you for joining us today. I'm Lindsay Lewis, the Manager of Community Outreach. Our speaker today is Husam Mourtada, the Medical Director of Medical Group of the Carolinas Spine and Pain Management. He received his Doctor of Medicine degree from Aleppo University School of Medicine. Dr. Mourtada is board certified by the American Board of Pain Medicine and the American Board of Physical Medicine and Rehabilitation. If you have any questions in the upcoming presentation, please type them in the Q&A box, and I will ask them to Dr. Mourtada at the end of his presentation. And now it's time to begin our presentation, titled, All You Need to Know About Low Back Pain. We are very pleased to have Dr. Mourtada join us today for this presentation. Welcome, Dr. Mourtada. I will now turn this presentation over to you.
Thank you, Lindsay. Good morning, everybody. Thank you for being with us today. I'm going to try to share with you today some information about lower back pain and try to answer most of the questions that I hear always from my patients. So to start with, we're going to talk about some numbers and statistics about lower back pain, what predisposed everybody to have back pain and risk factors, then explain a little bit about anatomy. And don't be worried, I'm not going to go into too much details. It's just to understand what you need to know so you understand better why we have lower back pain. Then we'll go over some studies that needed to evaluate any lower back pain and treatment options. So at the same time, we'll try to go over some of the terms that you hear a lot, like mechanical back pain, degenerative disc disease, FACET joint disease, or lumbar stenosis. So pain problems are very common, and the most two common problems are headaches and lower back pain. Lower back pain comes second to the headaches in terms of numbers. And because it's very common, it costs the medical system a lot of money, about $25 billion each year in medical costs to treat lower back pain. And on top of that, $50 billion for non-medical costs like losing job time and other expenses. There's at least 5.4 million Americans who are disabled with lower back pain, and for people who are under age 45, it's #1 cause of disability. As you know, some disease affect females more than males or the other way, but lower back pain in general affect both genders the same way. Until age 60, slightly increase of pain in women because they are more prone to have osteoporosis. Now, lower back pain is very common. It affects up to 90% of people at least one time during their lifetime. So that pretty much like everybody will have at least one time of lower back pain in their life. 40 to 50% of the lower back pain, on the other hand, will improve within 1 or 2 weeks. And the good news is up to 80 or 90% of patients with lower back pain, they will get better even without doing anything within 3 months. But when you have lower back pain, especially when it becomes more recurrent, up to 60% of the patients will have another episode within 1 year if you don't do what you have to do and try to prevent it from becoming a chronic problem or recurrent problem. What are the risk factors for lower back pain? Of course, the older we are, the more lower back pain we will have. But this plateaus after age 55. Some jobs can predispose the people to have lower back pain, especially heavy duty jobs. If the person has to do a lot of heavy lifting, pushing, pulling, twisting, all that can be predisposing the patient to have lower back pain. Also, the people who does not like their job or they are bored in their job, they are more prone to have lower back problems. The shape of the person, like taller people or heavyweight people are more prone also to have problems. Another thing is the shape of the spine. Some people are born with scoliosis, which is a curvature in the spine where it looks like a little bit like an S to different degrees. These people will have more chance of having back pain. Also, if there is difference in the length of the leg, what we call leg length discrepancy, and the bigger the difference is, the more chance of having lower back pain. As you know, some people are more flexible than others, and some people will be able to move easily and like bend their spine without any problem. Others are very stiff. They are just born like that. So people who have more stiff back or less range of motion, they are more prone to have problems. Of course, people with also weak muscles. So if they don't move a lot, they are deconditioned and their muscles are weak, not strong enough to support their back, they will have more, they are more prone to have back problems. And this goes with physical fitness. The more you exercise and you are more fit, you have better chance of protecting your back from problems. Smoking is a big problem because many studies show that people who smoke will feel the pain more than others. So if somebody continues to smoke, they are hurting themselves by feeling the pain more than others, any kind of pain, and lower back pain is one of them. Also, smoking increases the risk of osteoporosis, where the thinning of the bones, and they are more prone to have fractures. Even some surgeons these days, they will not agree to do spine surgery on patient who needs it if they don't stop smoking, because they know you will not heal very fast and they are more prone to have more pain after the surgery. Psychological problems like depression, anxiety, problem with alcoholism, all these can increase the risk of having back pain. But is it as a result for chronic back pain or they cause lower back pain? It's not sure. So another important point I want to focus on today is not all back pain is the same. And to understand this, we have to I'm going to go over the anatomy or what can hurt in the back. Because when we hurt, we all point towards our lower back. But there are so many structures there. And I'm going to go just briefly and show you some images here that show you how complex is the back and how many structures there are there that can cause the pain and things can go wrong with these structures. So to start with, always we look at the spine, the whole spine from the neck all the way to the tailbone. We have like 33 vertebrae. The biggest ones are in the lumbar spine. In the lumbar spine, we have 5 vertebrae, and they are the biggest part of the biggest vertebra of the spine. They constitute about 25% of the spine height. But this can change because as we get older, we lose some water, and I will get to this in a minute, and we have more curvature, so the height can be less. Another important information is to know that most of the bending, like the flexion and extension of the spine, happen at the lower vertebra of the lower back, and about 75% of that happen at this vertebra. This is why we have most of the problem at the lower part of the back. 20% happens on the next vertebra on top of it, and 5% of the rest of the lumbar spine. So in this picture here, you can see the vertebra of the lumbar spine, and you can see there's a big block in the front, and in the back there is more structure sticking out to the sides and straight to the back, and in the middle there is the spinal cord and the nerves that go through a small canal there, and these vertebrae are they have a cushion between each one and the next one, and that help reduce the impact when we are moving, jumping, and doing any activity. So again, here we see the same thing, looking at the vertebra, and you see this big block of the vertebra that we call the vertebral body. And this what takes about 80% of our body weight to transmit it from one vertebra to another. And on the back part of these vertebra, we have what we call the facet joints, or the joints that connect to each other. So each vertebra has like two hands going up to hold to the upper vertebra, and two hands goes down to hold to the vertebra below. And this will be connected together. And this is where we get also a lot of arthritis when we talk about facet joint arthritis, and that can cause also problems. The disc, if you see here on the right upper corner of this the screen, this is an example of the disc. And the best example is it's like a jelly donut, and I will show you more here about it. So the disc is like a jelly donut, and it has a small amount of jelly in the middle and more harder fibers outside. Of course, early in our life, we have small blood vessels that supply the disc and make it fresh. It's like a fresh donut, you just get it from the store. But over the years and up to age 30, these blood vessels, they get clogged naturally, and there will be less blood supply through these blood vessels. So the disc rely on fluids around the cells to give the nutrient to it. And again, it's the same concept. When you have a jelly donut, you put it on the counter. After a few days, it starts to be wrinkly and start to shrink. And this is what happened exactly to our discs. But now we talked about the disc and the vertebra stacked on top of each other. These blocks, they are not sitting in the air and they are not going nowhere, because we have very strong ligaments. They are like duct tape. I mean, putting them together and prevent them from going anywhere. There are a lot of ligaments in the front, in the back, in the middle. All that keep the spine in its place, and it takes a huge amount of forces to break these ligaments. So it's not gonna be affected unless major car accident or major fall, for example. Another level of support, and it can be also a source of pain, is the muscles. And you see here on the right side of the screen, there's two images show you how many muscles in the back supporting our the spine. There's many levels on top of each other. These muscles can go up, down, to the sides, oblique, all that. Many layers of muscles help support and keep the spine in place and protect it. It's like natural brace that hug the spine and keep it from having injuries. And this is why it's very important to strengthen the muscle to have a natural support of our back. The position of our body during the day, it changed the pressure in the disc, and the more pressure on the disc, the more we are prone to have a problem with the disc. So this gives you just an example here. For example, if you are standing and this is like 100% of pressure, this will be much less when we are laying down. It can go down to 25%. But if we are leaning forward, especially if we are leaning forward and lifting heavy objects, that can go up to 275% up. So that's very important, because that tells us if we have to lift anything, we need to avoid bending over and lifting any heavy objects, because that puts so much pressure on the back and increase the pain. So what are the potential, we call them pain generators? That means the structures that can cause pain in the back. So we went over the bone, the joints, the discs, the nerve roots that run inside and sticking out of the spine, the ligaments, the muscle, even the skin. Sometimes people can have, for example, herpes in their lower back, and it disappear and they are cured, but later on they start having pain over the same area where they have it if it was on top of the lower back, and that can cause pain. So they come with back pain because it's the area where they're hurting, but it comes out, it's the skin only, nothing wrong with their spine. So when we have a problem with lower back pain, the patient comes, we need to get details and have more information about the problem. When it started, if there's an injury or not, what makes it worse or better, how it's progressing, is it getting better or staying the same, or even getting worse? What type of pain, any other medical problem that can contribute. And this is very important, and I will touch base on it next, because if they have certain problems like history of cancer or infection, or they are taking immune suppressant medication for other disease, that can put them at risk for some dangerous problem. But these are very rare. We rarely see these, but we have to keep it in mind when we evaluate somebody with lower back pain. So, and this is what we call the red flags. So, as I said, somebody with HIV or on a certain medication that suppress their immune system, or for example, the patient start losing control of their bowels and bladder after an episode of severe back pain. These are what we call red flags that need immediate care or more sophisticated testing to check it. Otherwise, as I mentioned earlier, most of the pain can get better by itself. By 50% will get better within the first couple of weeks, and up to 80–90% after 3 months. So we start by the exam. A good exam is very important. We look at the spine, see the shape of it, if there's any curvature or not, see the range of motion, if they are stiff or more flexible. Also, we do a neurological examination to look at their strength or the sensation, the reflexes, and all that tell us if there's a problem and point towards any area that can be the problem. Another test is straight leg raise. That's very important when we do the exam for the lower back problem, because it tells us if there is any nerve root irritation. And next will be the question: should we do an X-ray or not? Most of the people who have lower back pain, they end up getting an X-ray. And that's a good start, always, especially if there is no red flags. Again, when there is no red flags, we can take the simple steps and after the exam, and be sure that there's nothing dangerous we are expecting. Getting an X-ray can give us some idea what's going on. The X-ray doesn't give you too much information, but give you enough information to start, because it tells you if there is some arthritis, if there is any major infection or a tumor. But again, it's not the most accurate test, but it is sufficient to start with this kind of test. But sometimes we do X-rays with what we call flexion extension, where the patient bend over forward and backward to see if there is instability in the spine. Now, everybody who has lower back pain, they ask to have an MRI, but in fact, it's not necessary to have an MRI of the lower back to start with, unless if there is specific reason needed, or if the patient go through the treatment and they don't get better, and we need to get more details, because excuse me, the MRI give us more details about the disc, the ligaments, the nerves. This information we cannot get with an X-ray. So this will be important to have in mind, that it's not necessary in the beginning, and we need to have it done later on for cases that does not get better. There are other tests like myelography or bone scan, and these are also not done normally unless in specific rare cases. Another important test we can do, and it's done to evaluate the back, is nerve conduction studies, or we call it EMG, electromyography, another name for it. And what it is, it's a test that look at the function of the nerves to see if the nerves are functioning, because the MRI and the X-ray, all what they do, they take a picture or an image of the structures. They don't tell you how they are working, if they are working correctly or not. The nerve test can tell you if the nerves are functioning correctly or not working. That's something you cannot find with the MRI or the X-ray. The next step will be diagnostic studies. Here we're going to talk a little bit about injections, because everybody think injections are only done to treat the back pain, but actually injections can be done to sort out what kind of problem we have. And as you saw, we have so many structures in the back that can cause pain. Is it the disc? Is it the nerve, the joint, the ligaments? Sometimes things are not as clear and straightforward. Things can be mixed, or multiple structures can be affected. And this is what happened in real life. You have multiple structures affected and causing the pain at the same time. So doing some injection as a diagnostic injection to sort things out and rule out what is causing the pain, what might not be the culprit in this situation can help. So we might do a nerve block or a joint injection, etc. So the injection in this situation, they have a purpose to diagnose the problem. So next we are going to talk a little bit about different types of lower back pain. We all hear about, I have degenerative disc disease, FACET arthritis, or degenerative disease, lumbar stenosis, or herniated disc. What's the difference between all these problems? So we're going to go over these briefly just to understand that each of these problems can manifest in a different way and need to be treated in a different way. Mechanical lower back pain, as the name shows, it's mechanical parts or the moving parts in the back, especially the ligaments and the muscles in the back can be the culprit in this situation, or sometimes the joint. Normally, that can be aggravated by physical activity. When the patient is resting, they feel better. Dull, achy pain can increase again with increasing the intensity of their activity level. And the pain stays most of the time in the lower back, does not shoot down to the legs. There is no sciatica, no radicular symptoms or to the leg. Their neurological examination would be normal. So because the problem is not affecting the nerves, and that's important to know, and these can get better by the correct exercise and physical therapy. Next is degenerative disc disease. Now, everybody will have some kind of degenerative disc disease because it's natural process of aging. We're all gonna have some kind of or some amount of degenerative disc disease. Some people will have more than others because of their genes, but at the end we're all going in one direction and everybody will have some. And most of the people, and which is the good news, they don't know that they have degenerative disc disease. The majority will have it and that's keep their life normally without any problem. But occasionally when the things get worse or get aggravated by an injury or anything that makes things worse, then the patient start having symptoms. And if it's coming from the disc, especially stiffness in the morning or limited range of motion because of that, that we need to look at it as a cause of the pain. And when there is bony growth of the around the disc or because of the degenerative changes, that can push on a nearby nerve and cause what we call sciatica. The other problem is facet joint disease. As I mentioned earlier, each vertebra has like two hands going up and two hands going down to hold to the vertebra above and vertebra below. And this is most of the motion and activity happen when we bend, go backward to the side or twist. These joints take all the stress. So with time, they're gonna have arthritic changes, or the tear and wear, I prefer to call it. The same when we have arthritis or degenerative changes in the knees, for example, or the hips. Normally the patient becomes stiff. Any activity leaning backward aggravate their pain. Leaning forward can help them relieve some of the pain. And the patient, of course, get better with rest. Sometimes we apply traction, and traction for the lower back. It need a little bit bigger machines too, because this is a big area of the body where, like, pulling the spine a little bit, that can help give more room in these joints and reduce the pain. Very common term we hear always, lumbar stenosis. A lot of people, when they have their MRIs or any studies, and they, oh, I have lumbar stenosis. What's that? A lot of the lumbar stenosis is very complex and can happen because of multiple degenerative changes or tear and wear in multiple structures, including the joints, when there's some bony growth, or the disc, and all that results on the canal where the nerves run in the middle of the vertebra. It becomes smaller. So the nerves have less room for them in the spine. Normally, this is a process that happened over the years, not going to happen overnight. And a lot of time, it's not going to progress very fast. So it's a very slow process. This is when we diagnose this, we have time. There is no urgency to say, let's say, do surgery. And even if we delay surgery in this situation, unless if it's advanced cases, it's not gonna make any big difference. This is why we always try other measures, from therapy, injections, to help the patient with their symptoms. Normally, the patient will have what we call neurological claudication. That means when they start walking, they start having pain in the legs, more than the back. But this pain go away after they rest and sit. So any increase in activity, leaning forward, like people tend to like to lean on their shopping cart, for example, when they are doing their shopping, because that relieves some of the pressure from the nerves, and that can be an indication of lumbar stenosis. So you see in this image here, that's a little bit dramatic here, that when it goes it becomes too advanced, that the nerves in the middle can be irritated and start firing and causing pain. Only in advanced cases we need surgery. As I said, you can wait. There is no emergency on this situation to have surgery or to fix it, because that can be, the symptoms can improve with other means. The next problem, which we always hear and will be worried about, is a herniated disc or lumbar disc syndrome or disease. Normally, this is a problem actually of younger people in their mid-40s. And this is why the average age for people who have lumbar laminectomy or discectomy surgery, their average age is 42 years. Normally, it happens after a bending injury, or especially lifting heavy objects, especially if you're lifting and twisting, that's very bad. And if you remember, I talked earlier about the disc pressure. It increased significantly when we bend and lift things, and that can predispose patients to have a herniated disc. But by the way, it's not that common. Actually, most of back pain happens with other reasons that I explained, and disc herniation is not very common. So when this happened, if you remember the jelly donut concept, the disc, when you push on the disc a little bit, the jelly starts coming out, and when this coming out towards the nerves, it can irritate the nerves by fighting with the nerves to have space in this narrow area in the spine. Also, it can cause inflammatory reaction, and this inflammatory reaction in the area can cause a lot of pain. Coughing, sneezing, or straining, or like having bowel movements, can increase the pressure inside the spine and increase the pain in this situation. And most of the time when it's irritating the nerves and pushing against the nerve, then we start having sciatica and shooting pain down to the legs. It depends at which level and which direction, because as you see in this picture on the left lower corner here, the disc can go to the middle or to the side, or in rare situation to cover the whole area. Degenerative disc disease, and this is something we see all the time. And again, I like the jelly donut concept again. If you see this image here, on the top is a normal disc. It's nice and have nice margins. As you put your donut on the side, and with time, it start to wrinkle and shrink, and that's what we call degenerative disc. If you start pushing on it, putting more stress on it, and because the structure become weaker, we can have what we call a bulging disc. That's when you start seeing this gel coming out from the jelly donut. But the bulging disc is very common. A lot of people come when they're worried because they have bulging disc. The majority of people will have bulging disc and they don't know about it. Unless if this bulging disc is getting in very close proximity to a nerve in a tight area, it will not cause any problem. The next step, or when it's more dramatic, is the herniated disc. As I said, when you squirt this gel all the way out, and then it sits inside the spinal canal where it is there's not much space, and fight with the nerves for space there, and that can cause a lot of pain. In advanced situation, especially with as we get older, the disc can be shrink and become thinner. The discs, as I mentioned earlier, they have about 88% of their content of water, but with age, that can go down to about 70% of their content water. So we lose about 20% of the water content of the disc. So it's like a piece of vegetable that when it's fresh, full of water and healthy, over time, also when it loses the water, it becomes it shrinks and wrinkles and become not healthy. The same thing with the disc. So I like this here diagram because it tells you how much degenerative disc disease or arthritis people will have without having any symptoms. This is they look at multiple studies and big amount of patients. Like for example, in the lower back, they looked about 3,000 patients who have disc degeneration. And they found people who are 20 years old, about 37% of them have degenerative disc, and they don't know about it. They are asymptomatic, no symptoms. And this can go up to 96 of people who are 80 years old. They will have degenerative disc disease, and it does not bother them or cause them any problem. So it's not because we find by chance, for example, we get an X-ray or any radiological study, we find a problem, degenerative disc disease, that means we have to have symptoms or we have to worry about it. Now, we diagnose the problem, we know, now we understand where it's coming from. We need to find out what are our treatment goals. Always we focus on reducing the pain, increase the function, and reduce the risk of happening again, and maximize the quality of life. The best thing to start with all these problems is conservative treatment. Conservative treatment, well, that means we use the least invasive treatment. Rest always should be very short, because the longer we are resting and not moving, we lose muscle strength and also bone minerals. If we lay in the bed and not move, every day we lose 1% of our muscle strength, and every week we lose 1% of our bone minerals. So few days of rest, and then we start getting exercise and focusing on strengthening of the muscles of the belly, the back, to develop this natural brace, because this is what's going to help make it better and prevent future problems. Physical therapy is very important in this situation. And aquatic therapy, water in the exercise, can be very helpful and important for patient with lower back pain, because your weight will be less stress on the back and structure of the back, and you can improve faster. Also, educating the patient about body mechanics, what to do, how to sit right, how to lift things. This is very important. Next, medication. Definitely starting just using something like Tylenol or anti-inflammatory like ibuprofen. That's the best way to start. Topical creams, anti-inflammatory topical creams, they are available now over the counter, or lidocaine or biofreeze. These can help reduce the symptoms so the patient can participate in physical therapy and get better. Modalities, here we are talking about heat, cold. Of course, in acute injury, it's better to use cold for the first few days. Then you can use either heat or cold or both, or alternating. It can help. Electrical stimulation can be very helpful. There's a lot of machines and gadgets out there that can help use electrical stimulation. Of course, these are medical devices, but can be now available without prescription. That can be helpful in blocking some of the pain signal. Pain control is important. So as I said, because we need the patient to be able to participate in therapy and improve their function, but narcotics is not the first step of treatment. That should be the last resort for chronic pain or extremely rare cases. In some situations, especially when the pain becomes chronic, psychological evaluation can help us find out the role of the psychological problem in the patient perception of pain, so we can address it and have them improve. This is an example of one of the machines. I mean, and there are many different types. There are small machines that have stickers. You put them across the neck, lower back, any painful area, and that they give electrical current that help block some of the pain. Of course, in the picture on the top, in the past, they used to have crazy gadgets there. Please don't try that. I don't know what they are doing here, hooking this guy to the wall with electricity. This can be dangerous. Next is injections and procedures. We hear a lot of people who have back problems, they get injections, and is again, as we said, not all back pain the same, not all injections the same. A lot of people, when they have an injection, they say they know that they have steroid injection. Steroid is the medicine that was injected, and most of the injection in the spine use steroids, but does not tell you where or what structure was injected. As you know by now, that there are so many structures in the back that can cause the pain, and you injecting different structure. If you inject the wrong structure, you might not get as much benefit. So injecting the correct structure, either it's a facet joint, a ligament, or putting some steroids over an angry nerve or in the epidural space, that can make a big difference. And there are so many different types of injection. You hear about epidural injection or nerve root block or facet joint block. Sometimes you hear about radiofrequency ablation or burning the nerve. That's how to burn the nerves that supply a joint that has a lot of arthritis and not responding to treatment. That can be an option. And in advanced cases, peripheral nerve stimulator or spinal cord stimulator, that's for more advanced and chronic patient in cases that does not respond to treatment. Here's just an example. When we do these injections, you see what matters is where is the tip of the needle is going and putting the medicine. There's many different spots and areas that can be injected. It depends on what's the problem. On the right side of the screen, you see this is the X-ray machine. We call it a C-arm. We use an X-ray machine when we do this procedure to make the injection accurate and safe. And it's called C-arm because it looks like a C letter. I mentioned peripheral nerve stimulator. This is something relatively new. These are minimally invasive procedure where we put a tiny wire, and you see here the wire, how thin it is compared to a quarter. And we put it close to the nerve that are exiting from the back, and the wire will be attached to a small machine, as you see here in the right upper corner image. It stays outside, so there's no cuts or surgery, and that stays for 60 days only. It stimulates the nerve, block the signal, and reduce the pain. After 2 months, the wires will be pulled out without any need for surgery or procedure. And they found with studies that that can provide with pain relief or reducing the pain for up to 12 months. So this is a very good option for certain patients. And again, this is not for all the patients, because that will not help with the patient who are having lower back pain that shoot down to the leg. A better option in this situation, what we call spinal cord stimulator. That's more aggressive procedure where a wire has to be inserted and put inside the spine, and a small surgical procedure to put this box under the skin. So, and that it's a little bit more riskier, but it might be helpful for certain patients, not everybody. Last resort is surgery, and I'm not a surgeon. There are so many different types of surgeries. Not everybody with lower back pain will respond to surgery or need surgery, but there are many different types of surgery, from minimally invasive to major surgery where they open big wounds, or putting hardware and fusion, or replacing the disc. That's definitely a small percentage of patients who will need surgical intervention, and they will that will be discussed with a surgeon who can give them the best option for them. So by reaching this point, I hope I gave you an idea about what is lower back pain, what kind of structures can go wrong or cause the pain in the back, what are the difference between the different terms that we hear all the time. And I will turn it now to Lindsay to see if there's any questions.
Wonderful. Thank you so much, Dr. Mourtada, for that wonderful presentation. It was super informative and super helpful to all of us on today. We do have a couple questions, so I'll get through as many as I can in the time we have. The first question I have is, are there any specific exercises or stretches that you can do to help protect your back or help reduce your lower back pain?
Of course, I mean, exercise, we like to call exercise as a medicine and need prescription. What it means, exercise, because people can hurt themselves with doing the wrong exercise, or some people can do exercise and they think they are doing exercise for their back, but it is good for other parts of the body, but it's not giving them any benefit for specifically for the back. In general, any exercise is good, but to focus on the back, the best thing is to do light stretching exercise with flexion, going extension to the side and twisting. So stretching is very important. And strengthening exercise is focusing on like crunches to strengthen the belly muscles, or extension exercise to strengthen the back muscles. There are some exercises you can do for twisting and activate the muscles that are on the side. This way you develop, as I said, a natural brace that hugs your back and give you a good support. Some people are more fit and they can take more advanced exercise. Some people, when they are not as fit, they can start slow and build up as they build up their strength. And that's very important, not to overdo it if you are not fit or never done exercise before, and go gradually.
Gotcha. Thank you so much. Another question we have is, Are there any specific pillows or props that you would recommend for somebody with lower back pain, specifically those that might sit at a desk all day?
The pillows can affect your neck more than the lower back, but sometimes if you are an side sleeper, putting any pillow in between the legs, that can help some, but it's not gonna affect the back pain too much. But maybe they meant if there's any pillows, if they are sitting on a desk all the time, a small pillow to cover the curvature of the back, to put it in the back of their seat, that can help support this curvature, because we have a little bit of curve, and that's natural. We have to have some curvature there. Filling that curvature with a small pillow in the back, that can give good support, especially if you are sitting long period of time. But it's very important, more than this, if you are sitting long period of time on a desk, to take a break at least every hour, even 1 minute, stretch and get back. And there are many apps now, and you can use it on your phone to remind you and show you some stretching exercise you can do from a desk for somebody who's doing a desk.
Okay, thank you so much. Another question we have is, do you recommend patients with lower back pain see a chiropractor?
Chiropractor manipulation can be very helpful, like physical therapy. But again, if they had their evaluation and they are sure there's nothing dangerous going on, and they know the exact diagnosis, chiropractic manipulation can help reduce the pain. But the chiropractic manipulation, I'll call it, is more a passive treatment for the patient. The next step will be using active treatment. That means the patient to do for themselves by exercising and stretching and strengthening their muscles.
Okay, wonderful. And the last question I have for you today is, do I have to have a referral to come see you as a pain medicine doc, or how does that process work?
Yeah, normally in our clinic, we prefer referral from their primary care doctor or any doctor who are taking care of the patient.
Okay, wonderful. Well, if anybody has any specific questions on how to get in touch with Dr. Mourtada, I'll be happy to include that in the follow-up email after this presentation. But I just wanted to again take the time to say thank you so much, Dr. Mourtada, for taking your time to present for us today on lower back pain. If you're interested in any upcoming presentations, please visit spartanburgregional.com/events. Thank you, everyone, and have a great day.